Let's resume our recording here. And we are what? 7 days away. Yeah, exactly a week away. 7 full days left of AEP. I think I hear you guys. It's been a long old road. It feels like a long AEP. Lots of disruption this year. Lots of things happening in every county, in every state that we're working in. I'm hearing the last week since Thanksgiving has definitely got busier for those of you that haven't been as busy as you wanted to be. And of course, we've still got some opportunity here over the next 7 days or so to really close out AEP as strong as we can. So we'll keep this short today, as we want to make sure we give you every opportunity to get back out there. Look at your activity for the next week. Try and limit the actual activity you're doing and focus on closing business. That's really what we should all be focusing on now. Go through your leads, recall your leads, call them again, and I'm sure you'll get some of them calling you as well, because that's what happens. I think as human beings, we tend to procrastinate. What happens is, as we know, that last day or that last evening, you'll get some calls and you'll have people wanting to sign up. So let's really finish this strong. Okay, so let's get on with our agenda here. Unfortunately, there's no Judy's Corner today. Judy's unable to make it. So we will be keeping this a little shorter than normal. So let's just run through here. Updates. As I said, 1 week to go, 7 days. I think it's going to be a pretty busy and stacked 7 days. I know there's only a few of you on the call today, and I kind of expected that, to be perfectly honest with you. So as I say, we'll keep today pretty short here. As you know, Medicare Part B costs are rising. They're going up to $174 and change next year. And of course, we know prescription drug plans, standalone premiums are increasing as well. This is a really good time to discuss those folks that may not be able to afford their Medicare supplement or their Medigap plan. We've got some great options in the marketplace now. PPO plans, for example, seem to be what a couple of the carriers are really focusing on this year, including United Healthcare. We've got some great PPO plans as well with Aetna, as well as Alignment, and then Humana in some areas as well. They've brought out their new PPO plan too. This Monday starts the scope of appointment exception to the 48-hour rule. So as of Monday, you don't need to wait 48 hours for a scope of appointment. Please keep that in mind when you're helping folks. You can sign them up straight away on that same day. Obviously, now we have that scope of appointment 48-hour rule, unless they walk in, unless it's a walk-in at a kiosk at an event that you're not expecting them, or an office or a Medicare resource center, to that matter, as well. And this Saturday, Rosa Calindros is hosting a United Healthcare Call Blitz for LA County. So anybody that wants to participate, please email Rosa direct. I've got her email on one of these slides coming up for you now. So please email her. You don't have to live in LA County to be able to participate. So if you don't have a ton of leads, a ton of activity, a ton of things going on, and you haven't really written that business that you wanted to, then that might be an opportunity for you to grab some additional appointments, leads, etc. That's tomorrow, 10 a.m. Also, Rachel Umarino is hosting Call Blitz today, I believe at 10 o'clock as well. And any folks that are in the Pacific Central Coast, I know United Healthcare has additional leads. So over the weekend, if you're in Ventura County, Kern County, San Luis Obispo, Santa Barbara, any of those counties, or want to have some leads, then just reach out to Rosa or Rachel. They'll get you some leads going this weekend, okay? One request from me, we've been sending out a template to anybody that's been doing our carrier and medical group sponsored events. So that's any of the events with Optum in California and SCAN, Archwell Health, CenterWell, and WellCare in Nevada. If you're doing any of these events, I need that feedback shared on the shared document that you've been sent every week. I'll get Eve to send that out to you today. Please put your details on there. I have added another column on there as well. So if you are not selling necessarily the sponsored carrier or enrolled anybody in the sponsored carrier, then and you've done other enrollments, I still need to know about those other enrollments, because two things: I need to know whether the return on investment is worth doing these next year. And secondly, I want to see how you guys are doing as well, what your results are as well, because obviously, we make decisions not lightly on who's going to be doing these meetings as well. And don't forget, if you're doing any other events, our portal does have the enrollment reporting tool. So any other AMA sponsored events, please use this tool. Thank you to those that have. I've been checking that every few days. And again, that is, an important part of what, I require for any sponsored or paid for events that AMA has participated or helped you with. That's kind of what we're looking for from you, just that feedback as well. If you don't know how to report on that, there is a recording that will actually tell you how to do that reporting as well. Okay, so last couple of points, really. The main updates this week is really following up on those leads. We were going to cover this in a bit more detail, but as I said, unfortunately, Judy can't make it today. Something came up, so I'm just going to cover a little bit on these leads. Any leads that you have that are 12 months or less aged leads, now is the time to call these folks. So this is where you should get into your Rolodex. Yes, Rolodex, your lead. Maybe you have a folder with all your leads in. Maybe you collect your lead cards, whatever you do with them, your CRM. Whatever you're doing with those leads, please start to follow up. Don't forget, if you've only called once or twice, that's not enough. Any sales call, really, you should be having 5, 6, 7 attempts to get hold of these folks. That's the only way, really, you're going to truly know whether these folks need your help or not as well. And again, don't forget, it's your permission or promise to call these folks. So you have promised you're going to call them. You've got to try your hardest to do that. So please follow up on any of these leads. Again, work backwards. So work to the most recent, because obviously the most recent leads are going to be the warmest leads. And, again, if you have been participating with any events and you've got these leads, or you can't get to your leads, say you've got too many leads, you can't get to them, these should be passed on to other people at these events as well. They should be shared out equally at any of these different events as well. So please make sure, if you've done those events and you need to get leads, talk to the presenter, talk to whoever did that, if you're a supporting agent as well, because you should be having access to some of these lead opportunities as well. Don't forget, we can't do everything as an individual. Share those leads out to the team that helped and supported you at any of your events. Same goes for your carrier meetings as well. If you've had supporting agents, they should be getting a fair, equitable amount of those leads, so you can all have the opportunity to follow up, because you are not going to be able to do this on your own, and that's just been proved over and over again. So if I can give you any advice this week, get into those leads, get following up, make sure you're accessible, clear out your voicemail. There's a few of you I've tried to call, it's gone to voicemail, but the voicemail said it's full. So clear it out, get your voicemail cleared out. We should never have that opportunity. You never know what you're going to miss, how many sales you're going to miss if that happens as well. This is that time. I know some of you have been under the weather, feeling a little bit run down, you're tired, irritable maybe, I don't know, but this is the time to persevere. We've got 7 days left. Follow up, keep calling, power through until the 7th of December. December 8th, next Friday, I am not going to do a call. I'm going to let you all have that rest, have a lay-in the morning, whatever you want to do, And we are not going to do a call next week. We're going to wait till the week after the 15th. And of course, that will be at 9 a.m. as well. So that will be back to our old time at 9 a.m. And of course, we'll send a reminder out next week and the week after. And again, just try and get through this next week. Persevere. I'm seeing a lot more activity at our Medicare Resource Center locations, a lot more calls coming in. So if you're not getting that, then it's time really for you to think, okay, what can I do to initiate some activity as well? That's my updates today. Really all about persevering, getting through this last few days as well. And really, supporting and helping those folks that need our help. Don't forget, if you're in a county that a carrier is leaving or that somebody is losing coverage, if they don't make it a choice now, they have the option to choose a plan after December 7th. Don't forget, there's a special enrollment period for those that are losing coverage through no fault of their own. So they have that opportunity during December to sign up still for January 1st. But if somebody is dual eligible, you can't use that special enrollment period for dual eligible until January. So, of course, this is only in the cases, for example, I'll give you an example in Ventura County, Blue Shield are leaving the market. So those folks that are on Blue Shield of California, guess what? If they don't make a decision by December 7th, you still have an option after then for them to make that election and sign up to another plan. The same in other counties. I know in Northern California, there's a lot of disruption. Scan leaving Sonoma County and whatnot as well. And WellCare's, coming out of Alameda County as well. So I know some of you are doing some great work up there. So we appreciate all you're doing. There's still an opportunity for those enrollments after December 7th where that carrier is leaving. Okay, let's go on to our updates this week. United Healthcare in Nevada here are really talking about some of the dual complete PPO highlights on their plan. And of course, some great products they do have in Clark and Nye County, as well as Washoe as well. And of course, you can access the Medicaid providers through the Nevada Medicaid website. So you should have seen that if you're in Nevada. Amazon will now be fulfilling OTC supplies for non-dual plans, so non-dual special need and non-chronic special need plans. So UHC, as the largest Medicare provider and carrier here throughout all states, really, is the first to leverage all of the products that are available on Amazon as well. Okay, so they can still use their UCard hub, and they'll be now fulfilled by Amazon as well online. WellCare still will have an opportunity next week on Tuesday, December the 5th, to talk about leads. I know Greg and the team up there have really been supporting and helping a number of you guys in Nevada with your lead opportunities. So jump onto that call next week if you've got time. Try and get some leads off these folks and really help yourselves, help these clients that need your help. WellCare Wednesdays, as you can see, they're going to be doing that throughout December. We've got Ascend training next week, the day before AEP ends, and then on to the 13th and 20th. And now in California, what do we have going on here? With Aetna, really kind of just talking about check the status of your applications. And this is a good point. I even had an application that I did for a change to one of my clients that is pending at the moment. So check in your portals to make sure these clients are pending. The other thing to do as well is if you are marking down what clients you have new for 2024, make sure they still have that plan. Reach out to these folks, send out thank you cards, because don't forget it's last plan in that counts. So if you have missed that opportunity and somebody has flipped who you thought was going to be a new client to something else, you still have the opportunity to move them back as well, but make sure your apps are not pended. Anthem's Medicare supplemental bonus has been extended. I think I mentioned that last week, but again, just wanted to bring that to your attention here as well. An extra $200 per sale for anybody under open enrollment, and then underwritten, you're going to get $150 that will be comprising of a multi-year bonus, $100 in year 1 and $50 in year 2 as well. And obviously just some examples of the math there at the bottom. So 10 med sub sales earned you $2,000. So there's no limit. There's no upper limit here as well. I know many other carriers are offering this type of deal as well. Also, Anthem is excited to announce that Dollar General is now in their grocery network. So again, if you have a grocery benefit or your client does in their plan, Dollar General is now in network in 19,000 locations. So this will be added on November 30th. So today it should already be added on the store locator as well. And you can find that through nationsbenefits.com. Okay, let's stick to any questions here. We've got 2 questions this morning. Still a disaster SEP. On that is very limited at the moment. It does carry on with a couple of carriers. I know Scan had that and United. They were the 2 main carriers with the disaster SEP, but that's going to end at the end of December as well. So as far as I'm aware, that is still going on currently at the moment for those carriers. Inventor, where Blue Shield is leaving, if an MAPD client decides they want Blue Shield Medicare supplement, is the deadline to get the PDP 12/7 or 12/31. Well, they do have a special election period if they're losing their plan. That actually will last until February. So they do, if a plan is leaving this time of year, they will actually have until February 28th to come off that plan and choose another plan. What I'm saying is they do have until December 31st if they want to get coverage for January 1st. Because obviously we don't want them to be without coverage. And that's the risk here, because all of these plans that are leaving counties, of course, are leaving as of 12/31. Okay, Blue Shield of California, their Medicare supplement program is continuing. As you can see, the bonus period runs until December 31st. And of course, that's that $200 bonus as well. And there's an additional dental bonus as well if you have an approved dental plan. Okay, the underwriting holiday is GA99, guaranteed acceptance code for all applications. Remember, you get a bonus on that, of course. The last day to submit is 12/31 as well. Important to make sure we know that as well. And then the Inspire and Total Dual MAPD plans. Sales kits are available in English, Spanish, Korean, Chinese, and Vietnamese. And of course, they also send out a benefits flyer as well. So you should have seen this if you're appointed with Blue Shield of California. Just on that, as we mentioned a couple of weeks ago, Blue Shield finally came out with a HRA program. It's only on the new dual special needs enrollments, not for any of the regular plans. And again, that's $100 HRA incentive program as well. And of course, these are available for in LA and San Diego on the exclusively aligned enrollment, which is the total dual. What that means is it's aligned with Medi-Cal, Medicaid here in California, and that's why it's exclusively enrolled EAE plan. And then the non-exclusive aligned plan is the Inspire D-SNP, and that's, of course, in Northern California in San Joaquin County, Stanislaus, and Merced as well. So beneficiaries must be new D-SNP plan members to Blue Shield to get this incentive as well. Okay, Central Health Plan and Brand New Day have just increased their HRA incentive for 1/1 to $100. So that's for the Central Health Plan. So, of course, lots of reasons to sell Central Health. If you've been selling these plans or offering these plans, there's some great products here available for your clients. As you can see, for example, in-home support service, 20 hours per calendar year. Doesn't sound a lot, but trust me, if somebody needs that support and help, it can be a huge help to some of these folks here as well. So that's about almost 2 hours a month they get help, and that could be driving somebody, a social visit, or even light cleaning, post-discharge homebound meals. I know a lot of plans offer this, but again, that's one of the key things that Central Health wants to talk about, and also their home and bathroom safety devices as well. $250 allowance for Medicare only plans as well, and then up to $3,000 for members with Medicare and Medi-Cal. Okay, let's keep moving on here with dental coverage, hearing, PERS, and then obviously their savings plan with their rebate of $120 per month as well, which is commissionable. Okay, don't forget, those of you that sell Scan Health Plan, there's two parts to this. If you're in California, the reimbursement program is up to $1,000 for your first 10 enrollments in California. If you're in Nevada, it's 4 enrollments and you get $400, $100 each. So that's the starting point. Your first 10 enrollments is $1,000. I've seen some folks, I think our top person in California has done about 80 apps. So in my math, that's about $8,000 of incentives. So congratulations. Fantastic news to a number of you that have written a ton of scam business this year. And those of you that are in Nevada, you've just got to write 4 pieces of business to qualify for that allowable reimbursement expense as well. And that can go up to as high as you want. Are we able to complete an HRA for DSNP applications done during AEP, but submitted prior to the program announcement? I believe that is a no. As far as I'm aware, it's for those 12/1 and 1/1 if you're talking about Blue Shield enrollment periods. My understanding is this is all for new business after the announcement, but I'll get clarification on that for you. If you've written a ton of Blue Shield business, please reach out and I will get that clarification for you. Scan, again, the marketing reimbursement, as I mentioned, this is the Nevada program, so it's 4 apps for Nevada as well. And those are just some of the things that can be reimbursed, and you don't need receipts. Okay, WellCare. What do we have with WellCare today? There's some issues with their evidence of coverage, so they've had to correct that as well. Their spendables card, so there's some issues on one of the plans that they represent. Express Scripts will become the new pharmacy benefit manager for all WellCare plans starting in January. New ID cards are on their way. So all clients are going to get a new ID card. They need to use the one with Express Scripts, not their old one. Please tell your clients that already have WellCare or you've signed up. Obviously, they're going to get a new one, but your existing clients need to look out for their new ID card. Flexible fitness options. Gym membership through either PeerFit or Ash or Silver and Fit is a great option for their clients, and also traveling to a fitness center or exercising may not be their best group. You can also get home fitness kits or on-demand videos or a virtual well-being club as well through Silver and Fit. Okay, let's go on here. Alignment Health Plan. Just wanted to talk about their 4 out of 5-star rating for their California plans. This is the 7th consecutive year that California HMO has earned 4 stars or higher. As you can see, these are all the plans that are 4 stars. And of course, last week of AEP, Alignment has everything you need. They get access to a network. They've got a cheat sheet with all their medical groups and hospitals for enrollments submitted with effective dates of 12 and 1/1. For their DSNP LAS plans, they get $150 HRA. And for CSNP, you get $100. And there's also a producer selling guide available as well, and some agent flyers for your use. Cigna, they're really excited to talk about some of their new commissionable drug plans, as well as coming into Nevada. One thing I want to mention for those folks on the call in Nevada, if you look at their network, particularly in North Clark County, so that's kind of Mesquite. As you know, Mesquite is fairly close to the border of Utah. So if they're going to travel to St. George, there is a medical group called Revere, which they have access. So they can cross state line to use their Cigna HMO plan in North Clark County, i.e. Mesquite, so they can travel to St. George and get their care in Utah, and they have some great medical groups up there as well. So just wanted to let you know that piece of information for those folks that are in Nevada. Okay, plan, enroll, lead campaigns are here. Agents are needed, helping to connect consumers to agents like you. Consumers will be encouraged to connect with a plan enroll agent for all their Medicare questions and needs. Become one today. You can get connected directly through exclusive leads through Lead Center. And the Plan Enroll exclusive lead program gives you freedom to work when you want, innovation, technology, and then integration with the Medicare Center and Lead Center as well. So if you want to still do this, it doesn't take long. It takes about 20 minutes to get yourself trained. Training.planenroll.com is the website there as well. Devoted Health, they are moving across the state here. I know we've heard rumors in Nevada that Devoted Health is going to be there for 2025. So if you don't know about Devoted, they're a pretty big deal there on the East Coast, particularly in places like Florida. They've got a few areas where they're a 5-star plan. So if you do sell Devoted Health out there in Florida or Texas, then you have free social media posts, videos, that type of thing they're offering as well. So there's some nice stuff they have on their website. They're a great plan to work with as well. Okay, now they're prepping for OEP. So, of course, making sure folks brush up on the election period reminders as well. If your clients who get extra help, they can't use the LIS SEP from October to December. Obviously, we're aware of that, the same as Medicaid. And obviously, the upcoming election periods, OEP starts January the 1st. And of course, if you are in a Walmart, you will be able to staff that Walmart. We don't have dates when that's going to begin. We have no information on that program at the moment. I know it's been a challenging year for those folks in Walmarts this year. Logistics, signage, and all the different hoops we're having to jump through for this program. But I appreciate all of you taking that responsibility to continue helping folks that go into Walmart stores. And of course, other kiosks as well. I know a lot of you have been doing kiosk work, events, that type of thing. And we've got a week to go, guys. Humana as well, original Medicare plan cost share update. The cost share has been updated on their summary of benefits. So, of course, if you're printing out that summary of benefits, it does have the new cost sharing for 2024 on all Humana printed plans as well. And, of course, you can see here as well, there's a shift. As I said, that PDPs are increasing. Look at that huge increase as well. The monthly PDP premium has gone up by $14 over the last, 17 years. So that's a huge increase, folks. It's almost doubled. So really, really important to note as well. But the average Medicare Advantage premium has not increased. So you can see there where the biggest cost issue is, and that's going to continue throughout the next 2 years. So this is not going to go away. Okay. Just some more information on Lead Center as well. They've got their real-time leads. If you want to be part of that, please reach out to Integrity through the Lead Center, and you can purchase your own leads through that as well. Okay. I think I ran through this week, just some of the United stuff they're offering us, like the plan identifier, and that type of thing that United has available for everybody as well. And of course, you can verify Medicare and Medicaid eligibility, and lots of tools. And a lot of the carriers do have these tools for you to make your job as easy as possible as well. Okay, where are we with time? We are good. We're going to hopefully give you about 28 minutes back. Again, WellCare talking about pending applications. Please go on to every carrier this week and make sure you don't have any pending apps. That if that's one thing you can get done, that's going to save you a lot of heartache, a lot of time and bother. Okay. Please consider using the short form application for current members only. So if they're changing plan and they're a current member, you can use that short form they have available for WellCare. That brings us to a close here on this wonderful Friday, the 1st of December. 7 days to go. It's all about getting through this next week, persevering and being there for your clients, and making sure that all of those apps are not active or pending, and not been pending for anything other than future active. So please check your applications, make sure your clients have not been flipped to another plan, follow up on those leads, and I'm sure we will have a wonderful last 7 days of AEP. Thank you so much for your time today. I'm going to give you 30 minutes back to jump onto those leads and your day. Have a wonderful rest of your day and weekend. I will be working all weekend as ever, so I will be available by telephone. If you need me, please reach out. If it's urgent, please text me, because I will be doing different events and support activities throughout the weekend and next week. So please, if you need me urgently, text me. If it's something that can wait until after the 7th, please do. So if it's urgent and you need that response for a client, happy to help you at any time I can. Thank you for your time. Have a wonderful weekend, everybody.